You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers or full mouth reconstruction. According to my first guest, he says your teeth and your gums are never too far gone or bad to have the smile you've always wanted. With us, we have oral surgeon, Dr. Jordan Swarbrick. Dr. Swarbrick, welcome to the program.
Thanks so much for having me, Randy. It's a pleasure to be here.
Okay, good. Now, I know you brought a stack of photos, so we'll try to get to as many of those as possible.
Perfect.
Now, this extreme smile makeover or full mouth reconstruction, as dentists call it. Give us a working definition of what we're talking about today.
Yeah, exactly. Full mouth reconstruction is kind of what is said. Really what that means is we treat patients with failing and missing teeth, gums that are bleeding, teeth that are just heading down the path of not really being salvageable or being able to be saved. And we help those patients in a very short amount of time, as little as 3 visits, get a brand new set of teeth, a brand new smile.
Okay.
Yep.
Now, what is your role?
I'm an oral surgeon, so I've went to dental school and then many more years, 4 more additional years to train in oral surgery and to learn how to do the surgery for these exact procedures.
So these complex situations.
Yep, exactly right.
I mean, do you feel, and I don't want to put words in your mouth, but like you have an unfair advantage as an oral surgeon doing this?
We do feel like we have an advantage. We feel like we've assembled a bit of the dental dream team in our center, in our centers that have everything a patient needs to kind of have a one-stop shop. This used to be something that patients would have to bounce between 2, 3, 4 offices to have this procedure done.
Okay.
Now we have the surgeon, the prosthodontist, the lab technicians, our specialty assistants, our anesthesia team, all under one roof. Patients can come in as little as 3 visits, get their dream smile and their dream set of teeth.
Now, you actually have like digital printers that can make teeth right there on the spot. Like you have an in-house lab.
That's correct. Right? That's correct.
So you don't have to send anything out?
No, we keep it all in-house, and that allows us to have control over the way this turns out and the way it looks. We want to make sure that the teeth going in our patients' mouths look like their teeth and are customized for each and every individual. And we're able to do that.
Anticipating you coming in for this interview, I was talking to an oral surgeon, and he said, Randy, you're going to see more and more of these oral surgeons teaming up in the same office with different specialists right there under one roof to make things faster, better. Can you elaborate on that?
Yeah,
is that what you've done?
That's what we've done, and that's exactly right. Really, when we created this, we thought if we were only treating family members and really good friends, how would we want that to look, and what would we want to do to treat?
Is that right?
Yeah. How could we best treat them is what we thought, and that was our goal and what we were set out to accomplish. And so what we've created is a center that makes it as easy as possible for a patient to come in and get this done. It's more efficient. It saves patients time and money, and ultimately it allows us to give them better results.
Okay. Now with this full mouth reconstruction, this topic is they're not necessarily ready to have all of their teeth removed. Is that correct?
That's correct. Yeah, some patients come in and they have several teeth that are beginning to loosen or break, and they just want to fill those spaces. And so with what we're able to do in as little as 3 visits, and the last visit, the day of the procedure being just a few hours, we're able to restore what they're missing and give them back their smile and their teeth. And this is something that used to take 10 months, 12 months or longer. And because of the way we've developed this center and having all the specialists under one roof, we do it now in one morning.
Now, your grandfather was also an oral surgeon. Are you just able to do things he couldn't do and help people that he couldn't help?
Yep, it's a great point. Just really in the last 5 to 10 years, there's been this huge development and huge transformation in the way these procedures are done due to the technology and digital scanners and things like that. We're able to do what used to take over a year, and this is something that some patients don't understand. That they still are going this route where they're going between 4 offices for over a year to get what we can do in as little as a morning.
Is that right? Okay, good. Now you brought some. So what are we looking at here?
Yep. So this is an individual, just an amazing individual, Claude. He came to us years and years of dealing with these dental issues. He said, the broken teeth, the discoloration, the pain was just getting to be too much to bear.
Now that's pretty bad. By the way, that's got to be unusual.
No, not at all. This is something that we see every day. To someone that doesn't work in the dental field, it may seem odd or unusual to someone like yourself, Randy. But there's over, the recent study I think I saw, close to 40 million individuals in the United States alone dealing with issues just like our patient Claude was dealing with. And back to your statement, Randy, is this unusual? It's not. It's just that these patients are so self-conscious that they don't show their smiles. We have patients that tell us that they constantly put their hand over their mouth when they laugh or smile. They're still wearing face masks when they go out and go to the grocery store. Yep. And so these are patients that we see walk in every single day.
So you think they're maybe grumpy or serious, and underneath they're hiding something?
Exactly.
Do you spot it as an oral surgeon? Like you could tell who's hiding their teeth?
Does that ever happen? Being in the dental field, we're trained to see these things and to spot these things. So we see it, I notice it. But the lay person, the average person out there doesn't realize what these patients are hiding and what they're dealing with.
Okay.
Yeah, we hear their stories, and you don't fully appreciate until you've heard thousands of these stories. But the place that they start in and the lows that they feel like they've gone to just having these broken and missing teeth. So we sat down with Claude, and he explained to us what he was dealing with. Not able to eat steaks that he once loved and enjoyed. Self-conscious to the point where he didn't even want to take pictures with his grandkids.
They say this?
He told us this. This is it's hard news to hear, but knowing that we have a solution is the best feeling in the world. Knowing where we can take him. And so pain, sensitivity, just drinking cold water, it would cause him so much pain.
Oh, really?
Yeah. And so what we were able to do for him, we were able in one morning to have him go to sleep. He was comfortable asleep during the entire procedure. Our team of specialists, all at the same time, were able to treat Claude. When he woke up...
And this was with a combination of procedures?
Yep. With a combination of procedures, we were able to treat Claude while he slept comfortably through this procedure. And he woke up, we were able to give him a brand new set of teeth that he went home with that same day.
Now, with sedation, let me ask you about that, because it seems so painful to have any dental work done. As an oral surgeon, I guess you're always doing like IV sedation?
With us being able to offer that sedation and let them know you're going to be asleep, you're going to take a comfortable power nap. When you wake up, this will all be done. You can just feel the weight come off their shoulders, and it's a big thing to be able to offer these patients.
So they're numbed up.
They're asleep.
They get some sedation.
Yep. They're asleep.
And do they have no memory or very little memory of the procedure?
Yeah, they don't remember anything. They're asleep. They're numb. They're comfortable. They wake up and it feels like they've just been asleep for a short amount of time. The teeth go in and they go home.
How safe is it?
It's incredibly safe.
Like, what do you monitor?
Yep, we're monitoring everything. We're monitoring their breathing, their heart, their lungs, all the important things. It's like if they were in a hospital having a very routine procedure done. Now, if you would, Randy, if you could put these before and after side by side, I want you to look at something here. This is a custom set of teeth that wouldn't work for a 25-year-old female. This was created just for him, for his face, for his lip structure, for his smile. Would you say, Randy, that the person in the after photo looks more sophisticated, more intelligent, more educated?
Yeah.
It's amazing, right? All we've done here is given him a new set of teeth, and right away you can just see, and when he walks into our office, his confidence is beaming. He's radiating confidence throughout the room. He's let us know.
What do they say when it's all done?
Oh, it's the best part. They come back and they tell us how their lives have changed. Sometimes they don't even fully understand or appreciate what will change.
How so, though?
No more pain, no more sensitivity, no more second guessing whether or not he could eat a meal. He was able to enjoy the steaks that he was missing out on again. I love that he was able to be with his grandkids and take pictures and feel comfortable smiling around them. It was amazing to hear how his life changed after this procedure.
You say they're healthier, though, when it's all done. How so?
That's exactly right. By definition, this individual is healthier. During the procedure, I removed and cleaned out a lot of infection that was present, active infection.
So it's a bacterial infection?
Bacterial infection.
So this guy can't brush it out or floss it out?
Unfortunately not. It's trapped in there beyond the limitations of what a toothbrush can handle. This is something that requires a more involved procedure that us as specialists can perform. When you look at this individual in the after photo, that infection's gone. It's cleared up.
So his
body is healthier because of that.
Do they report, because look, when you have an infection, you're kind of drained of energy. Do they ever tell you, like, I have more energy or I sleep better or anything like that?
I will tell you, I had a patient, this was one of the most impactful moments when I realized how important removing the infection was. There was a patient that the day after the procedure, this patient called us to let us know he felt 10 times better already. He didn't realize how bad it was because he dealt with it for so long that when it was finally removed, it just was mind-boggling to him that it could feel so much better. And that's what removing this infection can do for these individuals and for their health.
Now, when one of the doctors on your team or you, if you meet with a patient, they're telling you their hard luck story, do you ever get excited going, they have no idea how good this is going to be?
Oh, it's the best part of our job. Knowing the outcome of thousands of patients before them and knowing what to expect and the predictability of what we can provide as specialists, that's what gets me most excited, and what wakes me up in the morning is to help these patients that just don't fully understand how much better their life can be without pain, without sensitivity, without that self-consciousness covering their mouth every time they smile, to go from the before to the after and knowing that you're going to give them back something they've been missing for years.
Okay.
It's a life-changing thing for all of us.
Now, you may not know it with this guy, but how long do you think he hated his smile or didn't like his teeth?
He let us know. It had been going on 20 plus years.
So 20 plus years.
And it was multiple things that led to the breakdown of these teeth. And it was through this combination of procedures that we were able to restore in that morning his set of teeth and give him back his smile.
Do you feel like he kind of lost out on some good years?
I think he would be the first to tell you that. The one thing he said when he had the final set of teeth put in, he said, I wish I would have done this sooner. That's my only regret throughout this whole process. I wish I would have done this years sooner.
Now,
and that's very common.
Because nobody likes going to the dentist, right?
That's right.
Especially the oral surgeon. They're afraid of, right? That's when
right.
you're in serious problems.
That's right.
But do they ever, when it's all done, do they say, this was so much easier than I thought it was going to be?
Time and time again, that's what we hear. A lot of patients will tell us, this was 10 times easier than I thought. I was asleep for the procedure. I didn't even need Tylenol and ibuprofen afterwards. Now I have a new set of teeth. It feels like I'm free. I can enjoy my life again. And so we hear that very frequently.
Now you use IV sedation. Why not just the pill?
It's a good question. It's safer for the patient. When we provide IV sedation, it's safer for the patient. It allows us as a team to work more efficiently, to get better results, do it in a shorter amount of time. And ultimately, it's just a better, more comfortable experience for the patient. We understand some of the dental trauma they've gone to get up to the point to walk into our office, and we want to provide the most comfortable process to allow them to get a new set of teeth. And the problem with just a pill, Randy, is they're not fully asleep. They're aware of everything that's going on. They're feeling things that maybe they don't want to be feeling.
With oral sedation.
With oral sedation. A lot of times these providers, that's what they're offering because they don't have the license to provide a general anesthesia or in a sleep anesthetic.
Like IV sedation.
Like IV sedation. And it's not as safe for the patient. The patient still can feel things. And so it can still be somewhat of a traumatic experience for these patients. Our patients, they're taking a power nap. They're sleeping, and that's what.
So they wake up to a new smile.
They wake up to a beautiful new smile. Don't remember anything that happened, and it's a comfortable experience.
What do patients like more, the way it looks, or what they could eat and chew, like a guy like this? Like when it's all done, maybe 6 months or 12 months later.
Yeah, really good question. A lot of patients come in with different, desires and wants and needs. It's a little patient dependent. Some patients, they just want to eat that steak again, and they haven't been able to eat it for 20 years. Other patients, they're looking to get back on to the dating scene, and they want to have a really, really beautiful smile, and that's kind of their top priority. And the benefit is that they get both. These patients, they're able to eat and chew again. They're able to have the best smile when they walk in the room. And we have those patients that come in, the tough guy that says, I just want to eat and chew again. I don't care how this looks. I just want my steak again. And for those patients, they're going to get the ability to eat and chew steak, but the benefit is with this procedure, they're going to get the beautiful smile.
Okay.
And so after smiling and showing that smile off, the first 20 people, they forget about that they can eat and chew, and they like the smile. They say, hey, this is great. This is more than I could have ever hoped for. And so the fact that we accomplish both of those needs in one visit, one time, it's an amazing thing.
Very nice. You have more photos.
Yep. So let me show you this one here. Just the sweetest lady. This is Betty. Betty is a patient that came to us. She was dealing with pain, with sensitivity, missing teeth. You can see here in this before photo, she's missing several teeth. Her tongue's kind of popping through where it shouldn't. She was embarrassed to smile. She'd cover her mouth everywhere she went. If she laughed, she said she'd always remember to cover her mouth. She loved to cook as well. And it's sad to hear these stories, Randy, but it's what motivates us to do the good work that we do. She loved to cook, but she couldn't eat her own food.
She tells you this.
She'd make meals for her family and friends, corn on the cob, steak. She couldn't even eat the food. And so she comes to us finally in a place where she said, I'm ready to take care of myself. I'd like a solution. Can you help? And this is the ideal candidate. This is someone that we can take. with a combination of procedures, and in just a few short visits, we can give her a brand new set of teeth. So I want you to look at that after. And one thing I want to bring up, when we go back to the before, this is a photo that we took that it took us 5 tries to get her to try to smile, to give us a big smile. We say always, give us a big cheesy smile. She was so used to covering her mouth or hiding her smile that's the best smile we could get after 5 tries. She's still guarding it or hiding it a little bit.
So she didn't want to show her teeth in the smile.
So used to
it. Even
it's
at the dental office.
Muscle memory. She's doing it every day. So we go to the after photo. That's her. That's her smile. Okay. We're able to give her a set of teeth that just belong in her mouth. Look at the teeth. I want you to take a look here. This is a set of teeth that's custom designed for her smile and her mouth. It follows her lip line. It fits her facial features and structures. When she smiles, she's proud to show those teeth off. And that is a beaming, confident smile. That's what we love doing and are able to do here at our center.
Now that smile, just so I understand this correctly, that's designed on a computer.
Or
a program.
That's exactly right. With the technology that we have, this is what we're able to accomplish. We can work on that smile when the patient's not in the office. If we had to take that away and do it the old-fashioned way, our technology, our digital technology, if we didn't have that, if someone took it away, we're back to this taking a year and 10 more visits to get those teeth exactly where they need to go. With our team of specialists using this digital technology, we can nail it right the first time, more accurate.
Now, I'll put you on the spot. I mean, you're an oral surgeon and you have a team of specialists right there. So does it cost more to go to you?
It's a good question. You think it would? It actually costs less. It costs less to do it right the first time. Okay. And that's what we provide. National average, we're about 30% less than most of the providers that do this. And again, that's a combination of us.
And why is that?
It's because we don't outsource everything. We have everything in one house under one roof.
Meaning you make the teeth, design the teeth.
Yep.
Print the teeth.
From start to finish, the patient walks in one set of doors and gets it done in one office. And
so if somebody needs a crown, you don't have to send that out either.
Nope, we keep it right there in-house. Okay. Everything stays in-house, and that allows us to offer this at a lower cost and to do it in a better way, higher quality, better results. It's the benefit of having everything in one spot.
Very nice. Yeah. You have more photos.
I do. Yep. This is an individual. I love this story. This is Robin. This is a great story. Robin, he came to us. Wasn't the most social. Wasn't laughing. Wasn't smiling. Was guarding his smile. He had been complaining of failing and broken teeth. Was missing several teeth. He wanted help. He wanted a solution. Wanted a new set of teeth. I want you to look at this after photo. This is nice. This is the smile that he received the same day that he had the procedure. What's funny about Robin is he had a sedation. He went to sleep for the procedure, but he woke up really quick afterwards. He was ready to see these teeth. Okay. When he saw these teeth, he could not stop laughing and smiling. We let him look at these teeth for about a minute. He held the mirror, looked at every angle, put the mirror down. 10 seconds later, he said, "Give me that mirror again. I want to see these again." Kept looking at him and just could not stop laughing and smiling. He was so excited to see this new set of teeth. And from that point on, his life improved. He said eating and chewing, no longer a problem. No pain, no sensitivity. He smiled everywhere he went. And so I just love the fact that within that one day, this light switch was able to be turned back on, and he became this very sociable, happy-go-lucky guy again.
So you read him wrong in a way.
Read him wrong.
You had him all wrong. You had
This is the person that was hiding behind a bad set of teeth and behind a bad smile that had been weighing on him. So it's not like they become a
different person. They just return to maybe who they used to be.
That's how I view it. That's how I view it. This is giving them back something that had just been missing. It's not changing the person they are. It's not giving them something necessarily new. It's just giving them back what they once had. And to see that light come back into their eyes when they remember what that was like, it's the best thing in the world.
Now, patients tell you, "Doc, you've changed my life." Do you hear that?
We hear it day in and day out, and really I say it's them. They're the ones that picked up the phone. They're the ones. It's tough to be in that position when you're embarrassed to go outside, embarrassed to show these teeth, to take action and to pick up that phone and call. They're the ones that came in for the appointment. They're the ones that had the courage to move forward with treatment.
And spend the money.
They're the ones that did it. We were there to provide the service, to help them out, but ultimately it's them. And then they're the ones that get to enjoy the life afterwards and the foods and time with friends and stuff that they had been putting aside and too embarrassed to do.
It's amazing because, when we're talking on the phone, it almost sounds like an exaggeration because I always can't help but think it's just teeth. But these people live more active lives. Is it really the boost in the self-esteem, the self-confidence? What's your take?
Yeah, I think it's a combination of all of the above. It's something that has been holding them back.
Okay.
And they've been embarrassed about. It's been causing them physical pain and discomfort. And when they take that first step, it's like they realize they're capable of so much more. And they have that confidence back. They have the self-esteem back. And next thing you know, they're going to the gym. Next thing you know, they're dating again. They're seeing old friends, and it's this snowball effect that you see the confidence start to grow. You see the self-esteem start to grow, and they become that person that they always knew they could be, but they just had that weight holding them back.
We're going to take a quick break. We come back, more about the process and what they could expect on that consult on day one. You're watching the Wellness Hour. We're talking about extreme smile makeovers. We'll be right back.
Oh my God. I'm just happy that I finally did this and I have my finals on. Like when we have to wear face masks, I was happy. And that says a lot. When someone's happy wearing a face mask all the time. I don't feel like I'm being judged in any type of way. Like I feel really, I would tell myself, you made the right decision.
The end product is here. And you know what? You see them right there. Reva was my spot. You know how they say when you see a house or a car and you know it's meant for you to have? This is Reva. Reva was for me.
When I walk down the street and I smile at somebody, which I love to do, it will be a bigger, brighter smile. It will be with confidence and no longer covering my mouth if I laugh, because they're all there. There's no missing ones anymore. They feel good, they feel natural, they look amazing.
You're watching the Wellness Hour. I'm Randy Alvarez. Today's topic, extreme smile makeovers. With us we have oral surgeon, Dr. Swarbrick. How old? Like what are some of the oldest patients that are doing this?
It's a great question. There's no limit on age. We had a 92-year-old individual recently.
Why would a 92-year-old want to do this?
You know, a 92-year-old I think understands better than anyone. He wants to be able to eat and chew without pain. He wants to enjoy life to the fullest. And really, there's no limitation on the age that a patient can be. We have patients that are 70 years old asking if they're too old to have this done. Absolutely not.
So not even close.
Not even close. If you can walk into our office, you're probably healthy enough to get this procedure done.
So if somebody's watching this, and if you had room on your schedule, really bad teeth, really bad gums, right? And you did one of these extreme smile makeovers. And let's say it's a Monday. Could Friday they have their new upper, lower?
Absolutely, absolutely. In as little as 3 visits, within a week, we could do everything we need to gather the information, prepare for the procedure, complete the procedure, and give this patient a new set of teeth.
Okay, good. Okay. And we only have about 2.5 minutes left.
Okay.
And I know you have more photos, so I'm going to rush you a little bit.
This is our lovely patient, Jamie. Jamie was in a unique situation where she had ground down her teeth to where you can't even see them in this before photo. If you look at this before photo, really, we're only able to just get a glimpse of one of her teeth. Okay. She was very embarrassed to smile, to show her teeth, and it really affected her speech. The unique thing about Jamie is she was an English teacher and also did some motivational speaking.
Okay.
Speaking was incredibly important for her. And not being able to pronounce the words needed in her English classes and when she was speaking really got to the point that she knew she needed a solution. And so this is how she presented to us, looking desperately for a solution. Let me show you her after. This is with a combination of procedures, we were able to give her an amazing transformation. Look at her smile in this after photo. This is a set of teeth that was custom designed just for her. Not only did we want to focus on the aesthetics, making sure the teeth fit correctly in her mouth, followed her lip line, but it was so important to her that the speech was back to where it used to be, that she could pronounce and enunciate these words.
Okay.
So this set of teeth, this permanent set of teeth that she now has, this is giving her all of the above, the aesthetics, the ability to speak and enunciate again. And then the bonus was she didn't fully understand or appreciate how much better she was going to be able to eat and chew. She started enjoying all these foods that she'd been missing out on again, and really just gave her life back. It was an amazing transformation. And Randy, I want you to look at her side by side as well.
Yeah.
Would you say in her after that she is more educated looking, more attractive, more sophisticated? This is everyone. This is what this procedure does for people. This is what a custom set of teeth that is made for you will do for you. Can I show you this last one?
Sure.
This is an individual. This is Brian. I want you to look at his before photo, Randy. This is an individual that just the way his teeth were coming together was causing them to be worn down and him to grind. This led to lots of pain, lots of sensitivity, didn't have most of his back teeth, causing him to not be able to eat the foods he wanted.
So he didn't like to smile. Like, is this a case where you had to tell him to show his teeth?
He definitely would guard his smile, would cover his smile with his hand. Didn't laugh like he used to. Didn't smile like he used to. It just got fed up. I said I can do better. I deserve better. So he came in looking for a solution. This is our ideal candidate. When I saw him, I thought with everything else that he has, he's a good-looking individual. He just needs some help with his teeth. And so when I saw him, I said, "Oh, this is going to be."
So in your mind, you're thinking this is going to be good.
I've seen enough of these. I knew this transformation was really going to be incredible. I want you to take a look here at his after. Would you say that he looks younger?
Yes.
More energized?
Yes.
More educated?
Almost, yeah. And you can almost pick up on the charisma.
Yep, you can just feel it radiating through these photos. More successful, just ready to go out and enjoy life, which is exactly what he did.
What does he say when it's all done?
Oh, he was beyond grateful, beyond excited to start doing all the things that he'd been missing out on, eating the foods. I think he went and ate a steak later that night, the day that he got his teeth. One of the things that he was looking forward to most. Dating again, getting back out on the social scene, seeing friends that he hadn't seen in a while. No longer having to hold his hand in front of his mouth every time he laughed or smiled. And so just an amazing transformation. Again, if you saw this individual on the street, you would think that they were just born with this set of teeth. This is a set of teeth custom designed for him, for his facial features, for his lips. Just so excited about the transformation we were able to do for Brian.
So we're completely out of time. Somebody watching this and really bad teeth and gums, and maybe they feel somewhat hopeless, maybe without hope, like nothing could be done. They've heard what you have to say, but maybe they're still skeptical. What do you say to them?
I say your teeth, your gums, they're never too far gone for us to be able to provide a solution. I invite you to come in, see what your options are. There's always options.
Free consultation?
Free consultation. We'll sit down with you. We'll go over your options, let you know what those are, and be able to move forward with a treatment that gives you your smile back, your teeth back, and gives you a new lease on life.
Okay, good. I want to thank you for coming on the show. Great stuff. If somebody wants to make an appointment, do they just go to the website, make an appointment there, or just call the office?
They can either call the number that's listed here, or they can go onto our website. There'll be a number there as well. They can schedule, and like I said, we'll be waiting for them to go over, to be able to go over all their options and decide on what treatment's best for them.
So good stuff. I want to thank you for coming on the show.
Thank you for having me, Randy. Pleasure to be here.
You're watching the Wellness Hour, news that makes you healthier. For now, I wish you good health.